Well, thank you for the invitation. I got a PhD there. I don't deserve it. I'm still empty on that one. The PhD was an honor you guys gave me. I cannot accept it. Just smart people do that kind of stuff. So yeah, I don't know if these slides off would get even better because the slides are black. So,
oh, there's black.
Yeah. So, just for my understanding, how many of you have actually worked in any projects related to sleep? Any interest? Cool, like a lot of people. So cool, great. So I want to see how dry this is going to be or so. So yeah, the thing about Stanford, do you hear me well? Yeah, so I'm going to take this off. So Stanford has, I'm lucky to work over there. We do have, you guys know Stanford and all the, Stanford has one problem. It's ridiculously hard to focus. So many bright, shiny lights and smart people around me at any given time, and so many activities. You start getting involved with companies. What I think it is actually a very interesting stuff that we teach at BioDesign is actually how do you build a very transparent but productive relationship with companies in this whole ecosystem here in Silicon Valley. And at the same time, again, we have smart people from all over the place that come to work with projects with us as visiting scholars or for mentoring relationships. So it's a very rich place. Again, the problem is to focus. How do you keep focused and work? And so much fun stuff going on at any given time. So what is the problem we have in sleep? Around 30% of patients have sleep complaints. We believe that 80%, are you guys familiar with this thing called obstructive sleep apnea? Okay. So 80% of obstructive sleep apnea, that's a condition when we stop breathing or we decrease our breathing at night, and most likely we come for treatment because we have a partner or a friend that cannot be around us. So we have developed this diagnosis of sleep apnea. They are undiagnosed. Depending on what you call sleep apnea, up to 87% of males end up having a positive sleep study. So obviously we are over-diagnosing a little bit of what we are calling sleep apnea these days. We are perhaps a bit too sensitive. But there is a paper done in Switzerland, in Lausanne, looking at the overall population, what we call hypopnea these days. Then 87% of males end up having an apnea-hypopnea index above 5. According to this price of fatigue of Harvard 2010, around $40 to $65 billion a year in comorbidities and healthcare utilization. And there is Mark Guggenkrantz, is one of my mentors at BioDesign. And we know that sleep apnea in particular is what we call the 50-90 rule. It is a rule that we have in a lot of conditions in healthcare. The things that work 50% of the time are the ones that have low risk. The ones that have high risk or are very expensive, that's the one that works 90% of the time. So how do we actually figure out something that works 90% of the time but doesn't have the risks and doesn't have the cost? That is something that that's an opportunity in sleep apnea. Let me try to explain to you a bit more. Are any of you familiar? I know that Greg here is, but are you guys anyone familiar with overall sleep apnea care? Anyone is familiar with this thing called CPAP? CPAP, okay, cool. So here is more or less our patient. So we have Joe. Joe snores and Joe has sleep apnea. Joe's gonna go to a primary care physician who is gonna say, you know what, you snore. You need to see a sleep doctor. So he refers the patient to the sleep doctor. Chances are that the patient may not go to the referral and he's not gonna treat the sleep apnea. Then the sleep medicine physician is gonna say, you know what, you snore. Then you feel tired. So let's order a sleep test. The insurance may deny the test, or the patient may just not go. Or he may go. And then we monitor the patient for one night only, or maybe half of the night. And we're going to say, you know what? You have sleep apnea. They already knew you have it. And then I'm going to prescribe you a machine called auto CPAP, or I'm going to tell you, you know what? You need to come back for another test, where I'm going to figure out how much pressure you need on this CPAP machine. And then I'm going to prescribe you a CPAP. And then what happened? 50% of the time, people cannot use CPAP. they cannot tolerate, it's hard to sleep with, they feel pressure in the nose. So they end up seeing a dentist who makes an oral appliance that then in around 30% of the time, they cannot tolerate because they feel pain in this joint called TMJ, or their teeth start shifting. So they end up getting a bunch of other stuff, including a negative pressure device or a nasal piece called Provent, or they end up seeing me. And then we end up, you know what, I need to do some endoscopies on you, awake and sleep, and some CT scans, and then we do some surgery. That in 30% of the time doesn't work. And then they come back to see me and do another surgery, and then it may work. So my point to you is this: for someone that snores and feels fatigue, to get this resolved, it may take 6 doctors, it may take 5 or 6 tests, and it may take 7 or so therapies for someone to treat this condition. What do you think of that?
Very expensive.
A lot of money.
What is the risk of CPAP?
Stroke.
No, the CPAP, the machine.
The machine.
Ceiling.
What is the risk?
The risk.
It's
None.
Yeah.
Very minimal. Why do you need to do all of this to get to a CPAP machine?
Because it's expensive and they want to ration it.
Well, no, it's
Look how much you spend to get to a CPAP machine. It's $700 average. You spend $15,000 to get to a CPAP machine. Does that make sense?
no, it doesn't.
To a treatment that does not pose any risks for you. So this concept is something we teach our students at Biodesign called the cycle of care. The cycle of care in obstructive sleep apnea is very dysfunctional. And I'm surprised to say that a lot of conditions in medicine in general look like this. So one thing I would start looking at you, so this is my Biodesign hat, not necessarily my sleep hat, is start looking at the cycle of care of any disease. You're going to see that how deficient it is and how many people end up getting involved to something, in this case, that is such a low risk condition that CPAP has less risk than Thailand. So I'm going to move forward here. So this, all of you know, this is how much we spend in healthcare. So our country already spend around almost 20% of our GDP in health. And if you look at the rest of the world, it end up being around 9%. Latin America and Caribbean a little bit less. China is growing up, but it's still keeping around 5% or so of the healthcare expenditure. I'm sorry, the healthcare expenditure as a percentage of GDP. But if you look at the United States, we are not going to close this bill in a couple of years because we already spend 20% of GDP compared to anybody else. So now everybody's looking into how do you incorporate digital health into this equation. So one thing, for example, this company Jawbone, they closed. I think all of you are familiar with them, but just look at this. This was back, I think, in 2014, 2013. They had 10,000 lives just on the Bay Area. So there was this scientist, there was the South Napa earthquakes back then, and they had 10,000 lives that every night they could say what time you actually went to bed, exactly what time you woke up, and depending on the distance from the epicenter of the earthquake, you know exactly how long it took for you to fall asleep.
Wow.
Every night, 10,000 people, you know their sleep patterns. We're talking about nature here. The group nature is already exploring, and that's a big need that we have, and that's a big opportunity as well. How do we have all those digital health gadgets and we actually produce good quality evidence that they actually work, or that we can implement them in clinical practices? So that is a great opportunity we have these days. Healthcare is changing. It is more value-based, depending what you need to think that value is, but it's more value-based. It requires a more personalized patient treatment experience, and it's definitely going to be data digitally driven. I have no questions about this. The problem is how do we implement this? So I have no doubt that in a couple of years, I have the tired and sleepy guy who is going to grab his gadget that it got acquired by Apple, as you know. It's a sensor that is based on the mattress, or some other sensor that's based on nothing, or even some minimal sensor. And we are gonna be able to see how's this guy breathing. This guy's gonna go to Walgreens and get a CPAP machine. So I think this is the kind of thought process that enlightened people like yourselves should start thinking. What are the low-hanging fruits? What are the opportunities that we have to improve cycle of care and improve access to certain therapies that are pretty easy to get? So I have, again, no question that this is going to happen in a couple of years. The problem is how we are going to implement it. What kind of support are you going to have for the doctor for this to happen, or if the doctor or some healthcare provider? So I start getting very interested in this some 5 years ago. And we start looking, so one of the things that happened to me, I am a surgeon. So I get the patients when they cannot use the machine. So for the sleep medicine physician, the treatment strategy is pretty binary. You use CPAP, you don't use CPAP. If you don't use CPAP, then you come to me. Then I need to start breaking down what do you want out of this. What is the main reason why people come to a sleep clinic? Well, what do you think is the main reason that people come to a sleep clinic in general? Talk to me.
They sleep daytime.
They snore. It is not the patient, it's the partner.
The wife.
Oh, exactly, the partner usually. So it's kind of cute when you're dating. It's like, aww. It is not cute at all. After you have kids or so, it's like, dude, do something about it. So that's exactly what happens. So they end up coming to the sleep clinic. The problem is, how do you quantify sleep? Because I have people that I do surgery, and I ask the guy to record himself. The guy's making any minimal noise, and the partner is saying, you know what, see? He's like, dude, seriously? He's not gonna make less noise than this. So one thing I wanted to check is, how do you quantify snoring? And I started looking at the available apps for snoring. That is back in 2014. Back then, we looked, and we did this investigation. It was the hardest paper I've ever published. Doctors are very resistant to incorporate any new technologies into their treatment algorithm. Doctors are really hard. I mean, I didn't know none of this. I was a regular guy coming over here, then you come to Silicon Valley, you drink the Kool-Aid, and everything is technology, and then you submit the paper to publication, and nobody believes you. It's like, dude, no. So the same thing happened in medicine. So we did